Hi, everyone. Thanks for joining us. Today we are joined by Danny Yeung of Prenetics and Nathanael Faibis from Alodokter. Can you guys please join me up on the stage? So I'll let Danny and Nathanael introduce themselves, but quickly just a bit about myself and B Capital Group. We're a 350 million global venture fund based across Singapore, Los Angeles, and San Francisco. We invest primarily in growth stage companies across consumer, healthcare, financial services, and industrial. And one thing to note about us is that we are backed by BCG and have a strategic partnership with them, whereby we are able to connect our portfolio companies with their corporate clients worldwide. So I'll pass it to our panelists now. Maybe Danny, do you want to give us an overview about yourself?
Sure. Thank you, Hailey. Very excited to be here today. My name is Danny Yeung, CEO and co-founder of Prenetics. So we are a leading genetic testing company based in Hong Kong. So basically started the company about 3 years ago. 3 years ago, I think digital health and genetics was very early stage, but what we've been able to see is a tremendous growth in terms of consumer demand, as well as demand from insurance corporations, right? Because I think if we look at health in general, we're more and more realizing health is wealth. And I think the key thing is about prevention rather than treatment. So if you look at our company traction in the last 3 years, we've been able to grow from 10 people to about 120 people now. Where we operated as a small laboratory in Hong Kong, now we have 9 countries operational. We made our first acquisition in Europe about 3 months ago. So we're also expanding into China and the US. We've been also fortunate to have some really great support from the likes of Alibaba and Ping An. So in total, we have now over $50 million USD in funding just alone in the last 2 years. So we're really excited about what we've been able to do. But we also know that we still have so much more work to do because it's about education, educating people in terms of the value of why they should take proactive measures in health and why genetic testing along with digital health is really important for people to get interested in.
Great. Thank you. And Nathanael?
Next slide, I think.
Hello, everybody. I'm Nathanael. I'm the CEO and founder of Alodokter. Alodokter is the leading digital health platform in Indonesia. We started 4 years ago with digital content for patients, finding that people were looking a lot for medical information online, but were not able to find easy to understand and reliable medical information to take the right decision. And based on that, we started building an ecosystem for patients to manage their health with medical content in the form of article and video. Today, we are also the biggest telemedicine player in Indonesia with close to 300,000 chats between doctors and patients. We also started this year a booking system between doctors and patients. And we are soon going as well to propose insurance product for patients. So our objective is to provide as many solutions for patients in Indonesia to solve their pain point and make their management of healthcare easier. At the same time, we are also building an ecosystem for doctors called Alomedica that we started during the last 12 months. And same thing, Indonesia is a country where you have a lot of very severe healthcare issue, and we are trying to make the job of doctor easier by providing them accurate medical scientific information in Bahasa Indonesia, ways to communicate among each other with a medical social network, and also ways to make more money, obviously, by chatting with patients and by getting new patients. So we are building 2 ecosystems side by side with Alodokter, with close to 15 million active users at the moment, and Alomedica that is getting as well a very, very strong growth among doctors at the moment, and with that, making them obviously connect among each other. Thank you.
Thanks. So the first question that I wanted to kick us off with is, both of you have companies that have been able to scale across multiple Asian geographies. And we're all familiar with this market being very heterogeneous. I think in healthcare, there's additional challenges to that. You have a different type of healthcare consumer in each market, as well as regulatory structure, payment systems, whether they be private or publicly funded, as well as different levels of access and quality to care. So keeping in mind those challenges, how did you each come up with a product or service that resonates with the consumer in each of these markets? And how do the market differences impact your ability or choices around pricing and delivery?
Sure, at least for Prenetics. Right? So we are a genetics testing company. So what our tests do, it enables individuals to proactively help with their diet and lifestyle to prevent diseases from happening. So we started with that thesis, and the key thing is about the value proposition, regardless of the geography or the markets-wise. I think more and more people are valuing their health and taking proactive measures. Yeah? Because when you go to the doctor today, I mean, doctors are using their own personal experience, but nowadays people, when they're sick or a condition happens, people are Googling more. People are actually finding information themselves. They want to figure out the proper diagnosis. And on the genetic level, individuals can then see if they, let's say, have a predisposition to disease. So across the countries, we start with the strong value proposition. What is it that we're offering? And then can that go across different markets? So certainly, different markets are more in tune with, let's say, Hong Kong, Singapore. Individuals here are more in tune to, let's say, what's the optimal diet and nutrition aspect in terms of quality of life. So let's say when we talk about Malaysia or let's say Thailand or Indonesia, these consumers may be more interested in about disease aspects in terms of how do I prevent disease, type 2 diabetes, high blood pressure, high cholesterol, or things like cancer. Because with a simple saliva test, we can identify if you have a predisposition to inherited cancer. And that's very, very powerful regardless of where you live.
Yeah, so in our case, which is slightly different, there's two competing factors. The first one is that we are all human beings all over the world, so let's say that the healthcare needs are the same everywhere. But at the same time, you have one big difference, I think, in each country is who's paying. Is it the government paying? Is it the private insurance? Is it the employer? Or is it the patient himself? And who's paying will shape completely the way the system is working and the pain points and how the market is working, and you have basically to adapt a lot you market your product on that. So for example, we Alodokter expanded to Thailand, and Thailand and Indonesia are completely different market. Indonesia will be 60% private, while in terms of healthcare spending, while Thailand is only 10% of healthcare spending and 90% of public spending. And what we find is that the pain point for consumer will be totally different. So now I would say that when you are shaping your health tech product, knowing who's paying and understanding based on that what are the market forces is really critical in order to develop your product in the right way.
Yeah, so just to sum that up, having a unique value proposition for each consumer, as well as keeping in mind who's paying and what the value is to them. So on that topic, I mean, one of the things that a lot of payers want to see is consumer and patient engagement, which ultimately leads to some kind of improved outcome. But we see a lot of digital health companies having that type of market value proposition, but in some way or another kind of failing to deliver completely on it. What do you think digital health companies are doing right or doing wrong in pushing the needle towards engagement and improved outcomes?
Yeah, so the first thing on this, I mean, this is a great point, yeah, because I think when I look at digital health companies, there's a lot of digital health companies across the world nowadays, right? I mean, every single day there's probably tens and dozens of digital health companies opening up, but in reality, they don't really have a strong business model because number one, they need to understand who pays for it, as Nathanael mentioned, and number two, going back to the value proposition, what is that you're exactly offering and how does that create value for the user and that business? So when we went out in 2016, we started working with Prudential, AIA, etc., and then we went out saying, there's a vested interest for you as an insurance company to provide this as a value-added service. Because the healthier your policyholders are, the better that you are in the long-term wise, right? And then so when we've done our surveys, again, going back to the case with Prudential, we launched in 2016 in Hong Kong. Now we're in 6 different Prudential markets across Southeast Asia. And certainly one of the aspects, hey, show me the outcomes. So one key outcome that I can mention we're very proud of is that 70% of individuals which have had our MyDNA test results have made positive changes to their diet and lifestyle because of this. And the key thing is that because it's highly, highly personalized to the individual. Yeah? If I tell you that you're sensitive to carbohydrates, you need more vitamin B, vitamin C, etc., you'll take that personally rather than a general one-size-fits-all. Our reports have 104 million different variations of test results. Yeah, so that's very, very personalized. And I think we're moving towards the spectrum of where treatment should be always personalized, right? When you go to the doctor today, for example, we have 300 people in this room. If we go to the same doctor, the doctor will probably prescribe us the same medication. And it goes to a trial and error approach. Now with the advance of the genetic testing, we can understand what drug will work for us before we even take that drug. Yeah? So certainly you can see there's a lot of benefits to that. And going back to the value proposition. So I actually have a question for the audience here, right? How many people have done a genetic test? DNA test? Two people, right? So you see, imagine that. Yeah? If I told you guys the opportunity is that for, let's say, $100 US, you only need to do one genetic test. For the rest of your life, you'll go to the doctor and tell them, hey, don't prescribe me any drugs that will not work for me. Right? That's very powerful. So that's the value proposition of genetic testing, because it gives you so much more information where you don't have to go through trial and error. So going back to the value proposition is key in terms of engagement and measuring long-term outcomes, right?
Yes, so I think there's two big mistakes that people make when they start their health tech product usually. There's two kinds of patients. There's the sick patient and the patient who are not sick. The first mistake is thinking that people who are not sick deeply care about their health. We are dealing with 15 million users every month. We are answering hundreds of thousands of patients, and deeply I'm convinced that in most part of the world, people don't deeply care about their health until they are really sick or until they are sick. So many people start preventive application by thinking that people will be deeply caring about their health and they will be checking their health really regularly with their app or with their system. But unfortunately, what we see is that it's really, you need to have a very, very, very strong product to make that happen, because people don't deeply care about their health when they are not sick. Then you have the second group of people who have obviously more value. It's people who have a medical problem. Then you have another issue, which is how do you find and how do you communicate with those sick people? For example, if you want to find an audience about people who love sport cars, they're quite easy to target because they have it's quite easy to differentiate them as a group from the other group. But if you try to get, I don't know, people with diabetes or people with chronic cough, how do you target them? Nothing really differentiates them from the other groups. So finding them, if you don't have digital tool, if you don't have already a big existing audience, is actually quite challenging. And we see a lot of products that try to target those sick people group, but then find out like, okay, how do I find those diabetes people? How do I communicate with them? And how do I make them know about my product that can be great for manage my illness or to cure my illness? So I would say that one of the reasons why so many companies can have issue to deal with patients and have engagement from their side.
Yeah, that makes a lot of sense. Personalizing content as well as communicating effectively to both at-risk, sick, and healthy people. So my next question is related towards, actually both of you guys. So I mean, consumer genomics as well as health information and telemedicine, I think have both come under certain amounts of fire in markets like the US, where there's this debate about how much data do we give the end patient or the end consumer when if they know their genetic results, they might freak out and then decide that they're at risk for cancer and get a lot of tests unnecessarily. Where do you guys fall in terms of that debate, and how do you both safeguard your consumer, but also empower them with their data and information to make their own choices?
Great. So it's a great question, Hailey. Yeah? So I think that you're referring really back to 23andMe in 2015, where the FDA ruled that they have to stop issuing their direct-to-consumer tests for health risks. So that was a big controversy in the US, and actually recently, about 4 or 5 months ago, the FDA actually said you guys can release these results online directly to consumer. So, and just to share, I fully believe certain genetic risk information needs to be dealt with a genetic counselor to make sure that individual understands what he's getting, right? Especially for positive results. So for example, even for us, when we issue our positive cancer results to users, we don't issue them with, and it's mandatory they speak to a genetic counselor before they get that result. Because that's key. Because if we tell someone that you have a genetic risk for colon cancer, etc., they might probably freak out. They can't speak to anyone. They tell their family, etc. Right? But if they speak to genetic counselor and understand what that really means, then it's actually a really big positive. And to the point, I'll just use about 30 seconds to share my own story. 2 years ago, I did the genetic test for cancer risk. I, in the whole company, was the only person that had an increased risk for colon cancer. I freaked out initially, right? But after I spoke to my genetic counselor, the value of me getting a positive result, I'm very lucky, because I was 38 years of age. By me getting that, I proactively took measures and got an annual colonoscopy. The reason why that's important is colon cancer forms very long term. It takes about 10, 15 years to form. Annual screening guidelines recommended at age 50 and above. And 50% of these annual colon cancer cases are detected at stage 2 or 3. That means it's too late. By me having this result, I'm already taking proactive measures in my own hands because I don't want to wait until I'm 50 and I have early stages, right? So I think that's a really strong value proposition.
And what about an example with a health information platform like Alodokter, where a patient might have a few symptoms and then try to self-medicate or self-treat as opposed to go see a doctor?
So there's obviously many cases, but I think we can reverse the question. Is like, can we stop patients to find information about healthcare and themselves in today's world? It was possible 50 years ago. You had only the doctor to provide you information. But in the internet era, you just can't stop people to find information online when they have a problem. And you can't go to a doctor for any small medical issue, otherwise you will go to the doctor once a week, which is obviously not possible. I also take my own example from myself and my family. Both my parents are doctors, and I will never go see a doctor directly before speaking with my own parents. Why? Because they will explain to me whether it's urgent or not, whether it's serious or not, what can I do at home, what kind of doctor should I see, and when should I see it. Is it like tomorrow because it's really urgent, or is it next week, and so on and so on. So we can't stop people from going online, finding information, and I think that what is important on the other hand is to make sure that the information that they find online and that the decision that they take online is based on scientific data, reliable information, that it is ethical, and easy to understand for the patient to take the right decision.
I know we're running up on time, so last question before we go. We've yet to see, a major digital health exit in Southeast Asia. What do you think needs to happen for us to get there, and what might it look like? How does the market value tech-enabled services and content in healthcare?
Well, I think we are seeing digital health access, right? I mean, I think you look at Ping An Good Doctor, We Doctor, etc. They're exiting. But of course, the market is very large in China. We haven't really seen that in Southeast Asia. Again, going back to your point, that not many companies have gotten revenue. Right? They haven't gotten any traction, or they're very localized. They aren't global. So I think we are seeing that. And I think Prenetics, we've been fortunate to be one of these players where we are making great value propositions, getting really good revenues, and growing on a global basis. So certainly I think we'll see more and more of these exits in the next 12 to 24 months.
Yeah, relatively the same thing. I mean, I think that when we received our seed fund in 2015, we were the first sizable seed round in healthcare in Indonesia. Same thing, I think outside of Singapore, in Malaysia, Vietnam, Thailand, Philippines, same situation. So it's a really, really early stage market, a really mature market. And we see what's happening in China. A lot of companies are growing, and if we see the trend worldwide, it's going to happen as well in Southeast Asia, and we can see companies taking more size, becoming more sizable, and go to a very bright future.
Great. Well, time will tell. Thank you so much. Please join me in giving a round of applause to Danny and Nathanael.
And ladies and gentlemen, we say thank you to B Capital Group, investor Hailey Hu, for playing the role of moderator in that conversation, ladies and gentlemen. Thank you, Hailey.